So great to see everyone again. It's this time of year is always super exciting and a little bit nerve-wracking for all of us, and certainly for our students. Speaking personally with a couple of students heading off to new adventures, I know how difficult it can be for all kinds of people. But I think this year we have a little bit more normalcy to look forward to, hopefully. That doesn't mean, obviously, that we're not going to have tremendous challenges. And I do think, although we might not talk about it too much today, we know that the behavioral health challenges are really just, we are really just scratching the surface and week after week sort of learning more about what the last couple of years have done to our adolescents, our younger kids, our families. And so, I hope that this group will be able to pull together and help invest some resources into the mental and behavioral health of our communities. And I know that we will. And I think there are some great initiatives that are being undertaken. As far as what's going on at the hospital, we had a meeting just a couple of hours ago to actually officially discontinue operations of what was known as the Respiratory Care Center, formerly known as the COVID Center, and all kinds of different names. But we have reached the point where we haven't actually been operating out of the Aerosmith building on Route 1 for quite a while, but we've kept it sort of open just in case there was enough of a surge that we felt like we had to go back and have some off-campus place to provide either vaccinations or evaluations or care. And who knows, it might be a hasty decision and we might have to reopen it as the Monkeypox Center in a week or two. But we have closed the doors of the Respiratory Care Center, meaning that our primary care offices and our hospital is now able to sort of bear the load of all the testing and evaluating that needs to be done for COVID specific issues. We have all vaccinations available in our locations, and we continue to have not the sort of the huge surge of vaccination uptake that we did early on, but certainly we're vaccinating more of the youngest age group, 6 months to 5 years, who's the newest who's been eligible. And then we've talked to a lot of families who have been sort of on the fence about what to do, but are asking us sort of how to time their vaccinations. And I think return to school is a perfect opportunity to say, yeah, you're entering a new school year. If you remember how disruptive it was to be isolated or quarantined or have COVID and be out for 10 days and then come back and be a close contact again and be out for another 10 days. I mean, it was a tremendously disruptive protocols last year. That is certainly going to be less the case this year. And I think folks on this call know that at least some of the school nurses know that some of the algorithms that made it either possible for you to send a kid home or decide whether a kid needed to be tested or not, those algorithms have sort of gone by the wayside, and the main CDC is now going in line with the national CDC and treating COVID more as just a typical respiratory illness, in that if you are sick, you shouldn't go to school. And if you are at school and you have symptoms that might be consistent with COVID, if possible, you can get tested there. And if you can't get tested, you should go home and we will get you tested or do whatever needs to be done. The quarantine times are a little bit less than they have been. There are other changes to the school protocols. Cohorting is no longer recommended. Ongoing screening testing is no longer recommended for any of the schools unless you have a particular high risk situation. So a lot of the sort of protocols are somewhat going back to normal, although there are still more specific, if you are diagnosed with COVID, there are more specific quarantine requirements than there are for any other illness. Again, those requirements are less than they used to be. So 5 days home isolated and then back to school with a well-fitting mask when you're around other people. And we're hopeful that that is going to make it easier and less disruptive for students and families and teachers, everybody. The latest hot topic, because it's the first folks who get back into the school setting, is return to play for the sports teams. And I know that some schools have chosen to sort of do away with any return to play protocols, meaning if a student athlete has COVID, once that student is done with their 5-day quarantine period, they may be allowed to come back and start play on day 6 and get right back into competition. The main chapter of the American Academy of Pediatrics is still more conservative than that and is recommending a similar to last year, a 3-day return to play protocol so that a child, and basically we're trying to prevent cardiac issues, right? We do know that the COVID virus can cause a myocarditis that may be unrecognized until you start to push that heart. And we certainly don't want to have a tragic situation of a kid having a cardiac event on a sports field or a practice field. And so the physician offices are still sticking with a fairly strict return to play protocol, and we can talk more about those details at another time. That being said, there are other schools, other systems that are making different decisions. So I do think it's going to get a little bit messy. I do wish that the DOE or the MPA would come down with a firm universal rule, and that I know of, they haven't, but maybe they will, maybe they did 5 minutes ago, and I don't have that update for you right now. I guess one other thing from a school standpoint that is going to be sort of front and center, especially in the beginning of the year, is the impact of the vaccine requirements. Of course, that requirement has been in place now for more than a year for kids coming back to school, but I do think that school nurses and administrators understandably may not have paid as much attention to the impact of those laws as they might be able to this year. So you will have students coming back to school who are not up to date on their vaccines, and they will either need to have a medical exemption for being vaccinated, or they will need to have a very specific plan for what their intention is to catch up to those required vaccines. And we are happy to support that in any way that we can. So I could keep on going, but I will stop there.
Thank you, Dr. S. No, that was helpful. I don't know if there's any immediate questions specific to Andy's update before we move along in the agenda. As I said, or if you were able to look at the agenda, there is some time for us to sort of share ideas and talk about challenges in general for the start of school. But
I would just like to review the vaccination requirement piece of that. My understanding when we spoke, Andy, was that they were going to have to show their very specific plan, but also have a medical exemption letter from a pediatrician stating that they're on that plan. And then we were going to be notified if they're not sticking to that plan.
Yeah, so good point of clarification, Crystal. Yeah, so there are many families, or there are a number of families anyway, not just in our practice, but in practices across the state, who obviously have reluctantly come to the decision to vaccinate. And while they don't have a medical contraindication to vaccinating, are trying to go as slowly as possible in catching up with their full vaccinations. And for a family who has a 5-year-old who has never vaccinated before, even if the science tells you that you can get 7 vaccines at a visit and come back a month later and get 7 more vaccines, I just think that is, we're not going to win over any converts if we do that. And so we are willing to work with people with a more a slow rollout for catching up vaccines. In my conversations with Crystal, I don't think it should be the school nurse's responsibility to keep track of whether a child has come in a month later for their next catch-up vaccine. So what I have suggested that we do is the physician's office will write a letter describing that a child does have a very specific catch-up protocol, and we can either share the dates of that protocol or not. And then we, the physician's office, if we are willing to enter a relationship like that with the family, we will be responsible for keeping track of whether that child and family is keeping up to their side of the bargain. And if not, we will be in contact with the school to say this child is no longer on their catch-up vaccine and no longer has an exemption for coming to school. So I don't know if folks have questions or clarification needs to be.
So hi, Andy. So to be clear, when the plan is made, you know, they're either going to give us the exemption right out of the gate as we ask, you know, when we ask for it, and sign that and have it already clear what the medical exemption is, or the plan has to come from you. We cannot accept them. There's not some verbal agreement with the parent and they say, well, we're going to do it. It's not that at all, just to clarify.
I mean, I wouldn't accept that. And I don't think that that would be keeping with the letter of the law. And even as it is, I would say that the law, you know, we're sort of towing the line of whether the law allows these catch-up schedules to be as liberal as we are allowing them to be. Right. I mean, again,
You're being very clear. I understand what you're saying.
okay.
Okay.
Thanks. Good questions, for sure. That can be complicated. That was explained well. It makes sense to me, right? Why there has to kind of be a plan. Angie, do you have another question?
Not so much a question. What I'm running into is I've got a couple of families with out of state medical exemptions, and combed through the law, finally had to reach out to our legal because these families have been a bit argumentative. And, you know, these families are claiming that, well, during the whole COVID time when doctors could practice across state lines, that's when this letter was written. But what I've learned from the state and our legal team is that in Maine, the rule was that a doctor who wanted to do telehealth in Maine needed to apply for a temporary license, and the state would have record of that temporary license. And in my case, both of these families didn't have that. So I've made a couple of families pretty unhappy, unfortunately. But I did learn that out of state, they have, you know, their license would show up even through the COVID, you know, the big federal blanket where they made it really easy. They would still show up when you search a license. So that's just been good information for me.
Yeah, definitely. I'm sure that you guys might run into that a little bit more at Chewonki, but certainly there's other folks that are having students come from out of state. So helpful.
Oh yeah, these are day students at our elementary school who see local doctors, but have an out of state medical exemption.
Gotcha. Very creative. Okay.
Yeah.
Okay. Well, I think we can get to some more questions, challenges in a bit, but I want to allow Jeff Slack to introduce himself and give us a little bit of information. He's got some recently exciting news that he'd be happy to share. And if you don't know Jeff Slack, he is one of our favorite personalities at Lincoln Health, who has done so many things over the years to connect community members and individuals with services that they need. And so we're really happy to have this group know Jeff, at least by face, and he might be coming to a school near you to talk more directly to families about some of the services they provide. So take it away, Jeff.
Thank you for that introduction, Annie Pat. Hi, I am Jeff. I have a number of roles here, but what Annie Pat's talking about is the state of Maine has implemented a increase in the Cub Care FPL, which is going from 213% to 308. So a lot of your students who the parents may not have health insurance, and the students have not been able to get health insurance based on their parents' income. That is a huge increase in the federal poverty level. So Sandy Poland and I are enrolling, as you can probably imagine, quite a few kids, you know, into the Maine Care system to get them full coverage. I also assist with families who have health insurance, who have higher co-payments, deductibles, things like that. I don't know if I've spoken with any of you, but it's something that parents deal with a lot as far as getting their kids to the doctor's office when that they may have co-payments and deductibles that aren't being met by their financial needs, but that's something else that I can do with what's called the free care system here at Maine Health, which is nice to have for moms and dads for getting their children covered, with the medical visits and procedures that are needed for children.
And Jeff, so I know the folks that work here at Lincoln Health and in our school-based centers, school-based health centers call you regularly. So maybe for school nurses or administrators benefit, if you can just describe a little bit about what might be a situation where they might direct a family to call you to get help with applications, or can they do that even with existing bills? If they
Correct.
Okay.
Absolutely. Yeah. This is the free care system, which I mentioned goes back to the beginning of time. If the family qualifies right now and they have bills from 2009, those all of those get adjusted off to a zero balance. So like I said, what I have found a lot of times when folks call me is that when I'm sitting here talking with them, enrolling them in possibly main care, I ask them, what are there any outstanding debt, and they sometimes say from 2006, and I just do a free care application, and that cleans up anything that's gone to a collection bureau or anything that has to do with medical, and that's lab work too with Spectrum, and Nordex too works with us as well.
Awesome. So I don't know if folks have questions for Jeff about how they might access his services, but again, if we just had Jeff come to one of our internal meetings, and we're asking about like specific things of who would qualify, and he said, sort of like Andy said about the changes with COVID, right? Things change very rapidly. And so rather than, handing out a flyer that's going to answer all of the questions about what someone might be eligible for, we really recommend just calling Jeff.
Yeah,
Yeah.
that you call. I maybe Annie Pat's got some of my business cards. I don't see a lot of you, but I can give you my phone number if that would be of help.
Yeah, if you could put it in the chat, even Jeff, that would be
Absolutely.
great.
Perfect.
And really, I think one of the most challenging things that we find is that families don't know where to start, right? And that they are totally overwhelmed by the applications. I know, like every time we have to fill out paperwork, I feel the same way, right? So this is a nice local resource where you can get a person who will answer the phone and who can follow up with you, and who has an office, again, in our Aerosmith building. So if you were lucky enough to go over there in Damascata and get a COVID test for yourself or a family member or loved one, you're familiar with that building, but pretty conveniently located on Route 1 is where Jeff's office is. And he's always willing to answer questions and help people out, really.
And I pass this information along to the MAs and the doctors that I deal with on a daily basis. Sometimes it's easier for you folks just to give a little bit of background of what I do, but to have them call, because it's very financial based, and sometimes people are concerned about talking with that information with possibly you, but I have Annie Pat says just an open door. They call, I make it really easy, to start the conversation as far as what we're here able to do for them at Maine Health, and from the past and going into the future.
Thanks, Jeff. Any questions? Thanks for putting your phone number in the chat. And I guess now is the time that we set aside for folks to talk about any challenges that they have coming up in the new school year. And while we have Dr. Russ and Dr. Duchesne here as medical advisors to the schools, many of which are represented here, just to ask or share brilliant ideas that you've come up with, or already challenges you've kind of worked around as Angie described.
One of the challenges that I have in regards to the whole immunization thing is a student where one child is under an IEP. So even though they need vaccinations as well, they don't have to get vaccinated because of that individualized education plan. Although the mother feels like the child no longer needs to be under that plan. So then the question comes, if they take her off that plan, is she also going to have the immunizations? Which my thought process would say yes. But the other child, the younger child, has no vaccinations at all. So mom has now agreed to start the vaccination process. But they do see a naturopathic doctor. So my question to you, Andy, would be, I recommended that she call Lincoln Medical Partners because I don't like the naturopathic doctor cannot give that medical exemption letter if she's on a plan. Like I cannot accept it. So I recommended that she contact Lincoln Medical Partners to work with you guys with getting the immunization process going and the plan in place. So I don't know if there's anything else that any guidance you could give me on that.
I think everything that you just said there is correct, Crystal. Right? If a child comes off an IEP plan, they are no longer exempt under that IEP, is my understanding. Someone can correct me if I'm wrong there. Certainly a child who doesn't have an IEP, even if it's a sibling, would not be exempt. You're right that a naturopath cannot provide a medical exemption. It's MDs, DOs, PAs, and NPs are the only 4 licensed physicians that can provide that medical exemption. And again, there are really vanishingly few medical exemptions. We actually have had a couple this year that are, one, for example, a child who has not received measles, mumps, rubella, or chickenpox vaccine, which is a live vaccine, and that child has a parent who is on chemotherapy, and so it's contraindicated for someone in the family to have a live vaccine, right? There are real medical exemptions. I don't mean to say that there are not, and so those medical exemptions will appropriately come through. In a situation like that, if that child hasn't established care with us or with an MD or a DO, they would likely have to establish care with somebody. We do have vaccination catch-up clinics for our own patients and for, those practices, Lifespan, Full Circle, those practices with whom we have relationships, but we don't just have open vaccination clinics for everybody. So again, another interesting twist. I liked Angie's twist. I like this twist.
Also to add, Andy, in some places, well, because I can see the middle school students at Madomic Valley over there, there could possibly be, they could establish care through the school-based health center and start the vaccines. That's just another option. I don't know how much it would be of help, but we can do that.
Yeah, that seems like that would be really helpful, Jan. Thanks. Any questions about COVID protocols this start of this year? Are people feeling pretty good about it? Feeling like this is going to be easier for them to manage or more challenging, or none of the above?
I think overall the consensus I've heard in our community is just gratitude, grateful that we're starting to move back to being more normal, and also parents feeling like they're being trusted more. Whereas last year we were so on the top of everybody, telling them, mandating what they had to do. So they feel like they're getting back some of that freedom, and I think that it's a positive feeling in our community.
Thanks, Crystal.
I'm going to ask a question that I should probably know the answer to, but could you could you just give a little review of what our school-based health center offerings are for this coming school year, and maybe also speak to why we might have a representative from Morse High School here?
Yes, absolutely, Andy. I'm going to do that. I have some slides later, actually.
Oh, that's on the agenda. Oh, sorry. Sorry.
It's totally fine.
Okay.
So I will absolutely get to that. And, you know, I want to make sure that you all have an opportunity and ask any other questions. One thing, again, related to a meeting that we just had, are schools feeling like folks have enough at-home tests? We're definitely seeing a decrease in people coming to us for tests, but is that part of the solution for this year, that people feel like they have at-home test access for families? Because we do have free tests available through our practices, and we're able to get those to folks if schools find the need.
So I
That's
know
great.
for me, the ones that we received in the large bulk, they expire, if I remember correctly, December. So I'm just curious what's going to happen then, because I do have a lot left, but I'm wondering, what happens in January.
Great question. Did I see somewhere, Andy or Cindy, do you know if they actually extended some of the expiration dates on some of these tests? Again, I don't know how you would know which ones were.
So Annie Pat, the tests that we give out, Katrina, and we give them to our school-based health center people as well. Those are currently good until March of 2023. We get them through a rural health center because we're part of LMP, as part of rural health for some of the practices. So those are actually good until 2023. And then at that point, I guess we would have to see what comes out. But, if you feel that you need some after that, of course, we could provide those for you as well.
Does anybody
That'll get
know
us through
if
the winter.
DOE is allowing the schools to directly order tests in this upcoming school year?
I haven't heard that we are able to order more.
I don't believe that we are able to order more from the School Nurse Institute that we had. I believe that they're not going to have the tests available, but Krista Booth might recall specifically what was said. She also attended that.
The last that I heard regarding the test being available was that it was like a one-time situation where they were shipped out to us, and I don't know that they're going to be supplying any more for this upcoming school year. I was pretty certain that they said that if that was going to happen, we'd get notified, and I have not seen anything come across my email about it. So currently I'm under the belief that we won't be receiving any more home tests to be handing out.
It sounded like in some of the wording actually from the CDC is, test a student that seems symptomatic that you're trying to get to the problem that day. But if, they say to you, I'm going home in half an hour, to kind of ask people to rely on their own stash. Do all of you feel that way a little bit?
Yeah, like I said, I haven't heard them supplying any, so I think that it's pretty much people are supplying their own this year, unless something changes and there's another surge. My understanding from all the stuff and information I got the end of last school year and over the summer is that the DOE is not doing another shipment to be dispersed through schools.
That was my understanding as well. Thank you, Krista.
Well, and as Carol said, we do have, access through a HRSA grant to order more. And so if schools feel like it's a barrier for families, and that you're not able to get them through DOE, certainly contact myself or Brooke Bryant, who I realized I did not allow to introduce herself at the beginning, of all people to forget. Brooke, who works with me at the Coulomb Center, either one of us, who you probably get emails for various things from here at Lincoln Health, let us know, and we can certainly get you guys some tests to give to families that it may be a barrier for sure. And Brooke, actually, before I kind of go into my spiel, if you just want to, I think a lot of the people on this call are going to be at our session tomorrow at Lincoln Academy, but you put in so much planning. And I know there might be some state folks there who are going to be able to answer some of these questions, but want to talk a little bit about what you've got planned tomorrow at Lincoln Academy.
Yes, so excitingly enough, we have the School Nurse Skills Fair tomorrow at Lincoln Academy. Thank you, Crystal and Eric, for all your assistance with putting this together. We did this last year, but it's bigger and better for 2022, and we have a lot of information that we'll bring to the table tomorrow for all of our nurses. And yeah, and I think a bunch of you on here are attending tomorrow, so I'm really excited. But we'll kick off the day with some DOE updates. We'll take a little bit of information from this call too to start the day. And we have Melissa Keyport, Dr. Keyport. She'll be doing psychotropic meds, weight-based bullying presentation. We have anaphylaxis with Sally Larson, who's a nurse here at Lincoln Health. And we also have Lori Chapman. She's a nurse here at Lincoln Health who will be doing diabetes education. So we have a jam-packed day, and I'm really excited. So it's been fun planning.
Yeah, thank you, Brooke
Yeah,
and Crystal and
absolutely.
Eric. Right, as we said, we did this last year and realized that it was something that was really valuable and a good
Yep.
way to sort of kick off the start of the school year for our nurses.
We have about 25 people, I think, roughly to attend tomorrow. So that's pretty exciting. And then Andy Russ, I think you'll be a guest of honor at some point throughout the day. So
Brooke, can I just quickly ask, where are we going when we get to Lincoln Academy? Because I've never actually gone physically into the school.
Eric is probably the best person for that. I'm not too familiar with the campus, but I can send you the directions, Krista.
Yeah, I know how to get there because it's right down the road. I just don't know where in the buildings I'm going.
Okay. Yeah, Eric, you're the expert here.
Among a few of us, when you get onto campus, you'll see the big clock tower building, and you'll park opposite the clock tower and the gym. But as you're coming up the hill, you'll see a building that has glass floor to ceiling, and that's the dining commons, and that's where we'll be meeting. It's adjacent to the clock tower, and people will be milling about in front. So if you just park in that lot opposite the clock tower and walk across the street, and look for the glass walls, we'll see you.
Thanks, Eric. We're starting at 8.
Yep. And I'll be at the registration table too. So I'll give you everything you need.
Awesome. Thanks, guys.
Yeah.
Great. Any other questions, thoughts before I talk a little bit about school-based health centers and sort of what I've been up to this summer in terms of Lincoln Health? There will be more opportunity to ask questions, but I'm going to share my screen. Can you all see the screen? Yes, Brooke, I can see you. Yes. Okay. All right. So school-based health center, as many of you know, we have some existing school-based health centers. We've actually had them for quite some time, even though we were not totally recognized by the state or receiving any state funding. That seems to be shifting a little bit, and the state is recognizing the need for more support for school-based health centers. And so you can see we have some basic information here for the different components. So far, in past years, base funding has all that's been available. And as you can see on the table to the right as on my screen, that basically it comes down to how many students you have, what your free and reduced rates are, determines which tier that you fall into, which also then means you would have to provide a certain level of medical services. And this is the sort of bare minimum. You'll find that we actually provide in some places more hours than this, but medical services in this case, and in most cases across the state, it's a nurse practitioner who works directly with a medical director. Andy Ross and Cindy Duchesne are our two medical directors for our school-based health centers. And as you can see, Madomic and Booth Bay are currently funded. We just got funded with that last year. And then this year, again, they sort of very inconveniently bring these grant applications out in the middle of summer when, you know, schools are on vacation and lots of other people are on vacation. But so that makes it a little bit challenging, but we were able to work with Lincoln Academy to be able to apply for them this year. We're really hopeful. These applications were just put in last week. That we'll get some additional funding for Lincoln Academy. And as Andy alluded to, and Katrina being here today as a nurse from Morris High School, we have applied for Morse as well. And in the hopes that we will be able to start a school-based health center there. We're working closely with Mid-Coast Hospital, who has worked with Morse in the past. And they're both very eager to, you know, hopefully be part of our cohort here at Lincoln Health. They have a beautiful new building. If any of you have been there, I think they thought forward thinking about the space and planned to have a school-based health center in the future. And so we're hopeful that will come to fruition. And again, there's some additional funding that is available this round that we did apply for at our existing sites and our new sites. Really looking to let more people know that we're available and have clinics in schools. So increasing outreach, buying equipment to upgrade some of our spaces. Again, we've sort of in many of these locations just borrowed equipment from other places, borrowed things from the school. So just continuing to look to improve what we have available. And then exciting this year as well, and I know I've talked to many of you folks already about this, is dental services. We have been working really closely with one of the medical care development folks, which is a statewide organization working on dental health, and actually coincidentally Lincoln Health has been working with them on a project to see about whether we could integrate dental care into primary care a little bit more, recognizing the fact that lots of kids come to see their pediatrician or their primary care provider for well child visits, but not everybody gets to a dentist for dental care. And so if we could integrate that, we might be able to prevent some of the oral health disease that we're seeing a lot of often before kids even start school. So sort of parallel tracks there that we're working on, that we're hoping to have some more dental services available in primary care. And certainly it makes sense to look to model that in our school-based health centers as well. And this is just a quick slide to show a little bit. One of the great things about having a grant, it's also a challenge, but one of the great things is that it forces us to really look into the data in a new and different way. And so here's some of the data. We have more for the two existing school-based health centers than for Lincoln Academy, because again, we weren't required to track these same things, but you can kind of see a little bit about you know, who we are seeing and we do ask that all of our students, if they're accessing any services in the school-based health centers, become enrolled. And so those forms go out at the beginning of the school year. We've actually recently just added a feature on our webpage that allows families to link to and register right online, which is really nice, including signatures and insurance cards, which we hope will increase the amount of registrations that we get. Lincoln Academy actually has that part of their online registration system. So we're already noticing that we're getting a lot of registrations from Lincoln Academy, which is great. Oops, I didn't mean to switch just yet. One of the things that we're going to definitely be working on this year is looking at whether or not folks have a PCP, right? And making sure that we are really targeting those folks that recognize that they don't have a primary care physician, and looking to connect them with that service. Again, that's why Jeff is going to be an integral part of our team this year as we work towards getting people more connected to regular healthcare. And we recognize that cost is definitely one of the things that can be a real barrier. And just a little information over here about sort of what the makeup of the insurance is. You can see some of the payments that we receive for the care. I can tell you that those actual payments are about a third of what the actual invoices or bills that go out. So we don't nearly get as much back. That's just kind of unfortunately how a lot of our system works, and why the funding through the school-based health centers through DHHS is so important. And then lastly, really wanted to introduce to you all, as hopefully key members of this community advisory committee, this is something that is required by our grants, to have sort of a body of folks that are advising us on the work that we're doing in the school-based health center. As you can see here, they're helping us promote the school-based health center. You know, I think that's one of our biggest challenges, is that people don't necessarily understand what a school-based health center can do, how it might work together or work differently than your school nurse's office. And we recognize that more people connected in the community are probably the best way for us to be able to get that word out and to really have the best, the greatest impact and the deepest impact. And that's what we're certainly looking for. So we've kind of done that through these town halls in the past, and we've done that virtually, but this summer we've had a lot of conversations about how we can sort of shift to a different model and hopefully get representation from all of the school-based health centers, as you can see. And it doesn't mean just because your school doesn't have a school-based health center that you wouldn't be welcome to be part of this group. We recognize that many of these schools feed into the high schools that they will eventually be attending, and will have access to school-based health centers. And we really want it to be a community health center, not just for that exact site, right? And so we're thinking we will meet 2 times in person, and probably we'll sort of take the place of some of these town halls that we've been having throughout the year, and looking at November and May as possible times. And again, that would be kind of up to the group as we form to decide if those are the best times to meet. Kind of hoping that we could also relocate where we meet, right? So that we could also see some of the other school-based health centers, right? So if we start at Madomic and we meet there, and then people can see what that space looks like, talk about what things we're working on, how we're trying to get connected with more folks, and then at another meeting, maybe meet in Booth Bay or at Lincoln Academy. So that's a little bit about the Community Advisory Committee. Another component of the grants, and that's sort of already underway and has been underway for some of these school-based health centers, is youth involvement. So we also have small youth groups that are meeting within each of the high schools where we have school-based health centers. And again, really about having that community connection to the school-based health center work. And we recognize that, you know, I know Jan went to many of the health classes this year. Finally, again, COVID has been a huge barrier for us to be out, you know, letting people know that we're there. And Jan said, you know, right away, as soon as I went to the classes, kids started showing up more at the school-based health center. So it really is about integration within a community. And so we can't really anticipate what's going to work at each school. We think it's going to be really actually kind of nice to have multiple schools in one large advisory group, because sort of like this meeting, we'll be able to share ideas. What's working in one school might be something that someone else can implement at another school. So any questions about either the funding or how school-based health centers work? We're super excited to have more in potentially, hopefully, in the group as well. And Katrina showed me around, and again, I was like, wow, this space is made to be a school-based health center. So that's nice.
Thank you for including us even before we're hopefully receive the grant. So we really appreciate it.
And right, we didn't even really put it together when Midcoast had approached us because they weren't quite sure. They never run a school-based health center, and they said, well, hey, you know, our neighbors, LincolnHealth, have that because of the technical school as well. Many of the students from Lincoln County are also attending Morse, you know, multiple days. So Booth Bay, Wiscasset, and Lincoln Academy all send students there too. So.
Yeah, we work closely together, so it's great.
Jeff, did you have a
Annie,
question?
Pat, I forgot to say one thing. I also have access to free medication for folks too, depending on the medication that they're taking and of course the financial piece of it as well. So just, I meant to say that before and I totally forgot. So thank you.
Nope, that can be a really expensive piece too. So.
Jeff, do you also have a magic wand that you carry around as you go around?
It's so funny. Brooke and Annie Pat know me extremely well, that they've seen people that have come in and out of the office here. And I wouldn't say that I have a magic wand, but I've got to tell you that more times than not, as I tell these people, I've got a bucket that I can put them in, and it's usually, there's something that I can do for them. So.
That sounds wonderful.
That I would just add that there are a lot of people here who represent elementary schools. And as it stands now, the school-based health centers really lend themselves to a high school type situation where a student can sort of walk him or herself into the office. I know that that is a little bit different in Booth Bay, more outreach into the middle school and elementary school age groups. And so perhaps by bringing the community group together, we can sort of brainstorm other ideas about how we might be able to reach. I see Jan. Jan, this is just more work for you. Thank you very much. And Amanda, right? Job security. But again, right, you can imagine how difficult it might be for a first grader to find his or her way to a school-based health center. But I believe in Booth Bay, what happens is the school nurse will be in contact with the family. Family will say, yeah, I'd love for you to see my child in the school-based health center. And it really is an outreach of primary care for those younger age groups. So that's sort of a future direction too. Yeah,
absolutely. And as you could see on the visits, that a lot of the work really is behavioral health. As Andy said in the beginning, we recognize that's a huge challenge, and we're really lucky to have these clinically trained social workers available in the schools and accessible to families that way. So that's a lot of the work. So I won't ask you all to commit just yet to be on this group, but again, I think it will be not a huge commitment, but one that will be important to have sort of a couple of people from different disciplines or different backgrounds from each of the school-based health centers to be part of this group. And there's a lot of potential to make some really great improvements and changes in these school-based health centers and make them really great. So if you would like to be part of that group, again, please contact myself or Brooke and let us know.